soaring high and making difference, where we talk anything about nursing. So let your voice be heard right here. Moments with Professor X.
Hey everyone, how are you guys? I miss you. I miss everybody. How are you? Anyway, it's today's actually Saturday and it's June 6, 2025, Saturday 7:28 p.m. my time, and it's been a while no, ang tagal kong nawala. I was out for about 2 or 3 weeks, no, 2 weeks. And then my God, who's here? Thanks for watching, Muhammad Noor Glimada and Asher C. Thanks for watching. Now, anyway, when I was driving a while ago, I went to Seafood City, the pambansang grocery shop ng mga Pilipino dito sa Las Vegas. So while I was driving, a student messaged me and she was asking, "Sir, can you give us a tips or a nice preparation for NCLEX examination?" So I gave her some tips, my personal preferences, and all those stuff. So while saying that, and it just popped up in my mind, why not make a video about tips how to prepare for the NCLEX examination? Okay. Anyway, bago ang lahat, hello to Labster26. Labster26, good morning, good evening. This is nice. Welcome. Thank you so much for watching. I hope you will learn something today, Labster. So, yun nga, no? So I decided to create this clip or do Facebook Live and talk about personal preferences or tips if you're planning to take the nursing qualifying examination. But by the way, this is not only for the NCLEX preparation, but also to any type of uh, qualifying examination. So if you're in the Philippines, I think this will also help you if you're planning to conquer the NLE or the nurse licensure examination, or somewhere in the Middle East if you want to take your, prometric DHA, or generally any type of nursing qualifying examination. So for those who don't know me, my name is Sander Ray. I've been a nurse for, oh my God, I've been a nurse for 23 years. And I've been doing NCLEX preparation for about, how many years now? More than a decade. Like, I guess 18 years. 18 or 15 years now. So apart from that, I'm also doing some review programs for not only for the NCLEX RN, but also for the NCLEX PN and other nursing qualifying examinations. So technically, my what do you call this? My professional career circulated both in the academe and in the clinical setup. Okay. So anyway, these are just my personal preferences. Okay. So this may be good or applicable to you or may not be, okay? Because again, this is a personal preference. So allow me to share my screen and let's go from there. That's a switch. There. Okay, so I have here 5 game-changing prep strategies. Okay, so my first tip, if you want to take your qualifying examination, by the way, the main purpose why you have to take the qualifying examination is that because they want to know if you know what are the things that nurses do and should not do. Technically, they want to know if you're a safe nurse or not. That's it. Okay. So, who is this? The best NCLEX reviewer, lovingly. Thank you so much, Labster. So, my first tip is actually to study the basics. Okay. Study the basics. Now, remember that the foundation in nursing, the basic concept Okay, just like your anatomy, physiology, fundamentals in nursing, these are actually the foundations of the nursing concepts. If you do not know the basic, okay, then you will have a hard time understanding, comprehending uh, a more complex nursing concepts like pathophysiology, pharmacology, okay, or any pathogenesis, medical surgical nursing. That is why, please, please, please go back to the basic. Okay, review your fundamentals of nursing, review the nursing process. Now, come to think of it, if you do not know what's normal, okay, this is the normal physiology, how will you be able to identify that things going on to your patient is already a form of abnormality? See, you need to go back to the basic, know what are the normal things, physiologic things. Okay, so learn the basic, understand. Remember, when you study to understand, not to memorize. Okay, so that is why some students will tell me, sir, how are you able to connect all those things? Like when you talk about pharmacology, you discuss this, and you correlate this to the specific body system, and then you talk about this, and then this one. It's all because you understood the concept. Okay, so please study the basic, because the question in your qualifying exam are basic concepts. Okay, so that's tip number one. Number two, choose the right review material or materials. This may be an issue for you, okay, or an issue if we're gonna explain this. So it's all depend if you want to follow this or not. Personally, I would only choose 1 to 2 review materials. Do not overwhelm yourself with several textbooks and several review materials. I am not saying they're bad, okay, that you will not benefit from it. To name, we have several review materials right now. Like you have your ATI, you have your, what else? You have your Clemic, you have your Archer, Kaplan, Lippincott, name it. They are all good review materials. But you have to choose 1 or 2. Do not overwhelm yourself. I know if you have friends who took the NCLEX, chances are you will ask them, "Hey, how was the NCLEX exam? What material did you use?" And most often than not, they will tell you, "Oh, I I used this material and it helped me a lot." Okay, and then you have another friend who took the N class and he made it or she made it, and you will ask the same question, like, "Oh, how was the examination? What number did you stop?" And then he or she will tell you, "I stop at number 85 and I use this review material." So you have now in your mind, between your ears, I need to get those materials. So chances are you will purchase all those materials. You overwhelm yourself to the point that on the day of your examination, guess what? You did not even finish, you did not even answer the whole or one of those review materials. You overwhelm yourself. Okay? So please do not do that. Do not do that. Now, speaking of review material, remember English, this is especially for Filipino nurses who are planning to work here in the US. English is not our first language. That is why, for those who are planning to take the NCLEX examination, if English is not your first language, find a review material that is easy for you to understand. Okay? Find a review material that you can easily grasp the idea. Now, I'm telling you, pneumonia in Archer, pneumonia in Mark Clemic, pneumonia in ATI, they're the same pneumonia. Okay, the same disease. It's just that an author may have a several way or a special way to present the concept. So find a review material that is suited to your, shall I say, learning curve. Forgive me to say that. Okay, or find a review material that is suited for you. Okay, now, apart with their review materials, in the Philippines, we have a lot of review centers. Oh, anyway, hello to Angela Solomon. How are you? I miss you. Okay, now find a review center in the Philippines if you're in the Philippines. Okay, that is a credible review center. Look at the roosters of their professors, of their review specialists. I know I was part of that industry, review center. I know that there are review centers who will let professors teach NCLEX review program but they are not actually NCLEX passers. Okay, so find a credible review center. Is there a way for us to know whether that professor, that that someone that a teacher is indeed an NCLEX passer? Yes, there's a way. You just need to get their complete name and the state where they took the NCLEX and passed the NCLEX, and you go to a specific website. The website is www.nurses.com. So the spelling will be NURSYS.com. So it's nurses.com. So you just to key in the name of the person and the state where he or she claimed that he took and passed the NCLEX. So you will know if he or did pass the NCLEX examination. Okay? So that's number 2. It goes with the review materials, just like a review center. Okay, that's tip number 2. Tip number 3, by the way, here, hello to JD. Hello, sir. Kumusta? Nice to see you again. Joseph from New York. Hey, kumusta na, Joseph? ¿Cómo estás? Hey, Angela, how are you there? I miss Erie, Pennsylvania. By the way, Angela is a good friend, and we used to work together in Erie, Pennsylvania. So big shout out to all nurses there, to north of St. Vincent Hospital, Erie, Pennsylvania. I will never forget that because that's the first hospital that I work um, the moment that I arrived here in the U.S. Okay. Oh my God, I remember the winter time in Erie. Woo! Anyway, I miss you. I miss all the nurses there, the CNAs, and of course, who else? All the charge nurses, and of course, my manager. Hello to Love Victoria. Thanks for watching. So that's tip number 2. Okay. Tip number 3 is do not jump to conclusions. Okay. In short, sa Tagalog, wag mong pangunahan yung tanong. Don't be judgmental. Do not jump to conclusions. Now, can you explain more on this, Professor? Sure. For example, you're in the actual NCLEX exam testing site and you read a specific question. For example, patient here is having myocardial infarction, complaining chest pain. Few words, right? Patient is having MI and is complaining chest pain. The moment you saw the word chest pain, you already jumped into conclusion. Oh, the question here is something to do with, I think, morphine because it mentioned chest pain. No, do not do that. Huwag mong pangunahan yung tanong. Do not jump to conclusions. Bottom line, read the questions word per word. Okay? And take note when you read the questions, don't forget, answer what's being asked. Okay? Just answer what's being asked. Simple as that. Okay? Next, another tip number 4. My God, I'm so quick. This is a fast Facebook Live. Anyway, here JV Mata said, how to be you po. Hey, hey, I'm also an aspiring clinical instructor. Oh, that's nice to hear. Best NCLEX instructor. Thanks, JV. You know what? Uh, I don't want you to be like me, JV. I want you to be better than me. Okay? If you want to be a clinical instructor, make sure that you have passion to teach. Okay? I have seen a lot of brilliant people, like they ace all the concepts in nursing. This is based on my experience. Okay? I've seen a lot of, when I was still in the Philippines, I've seen a lot of board top notchers in the Philippines who applied as part of my team as a review specialist. But when I let them deliver a specific topic, I cannot connect with them. Not because that I've been teaching for quite a while. It's just that I always put myself in the shoes of a new graduate. So the point here is make sure you develop, you hone, you practice your teaching skill. Teaching is actually a skill. Not all intelligent people, not all smart people can teach. Okay. So I want you to develop that. Okay. Number 2, if you want to be a good clinical instructor, do not stop learning. Okay. Do not stop learning. Learning never ends. Okay. Learning doesn't end after you finish nursing, it continues. Why? Remember, new medicine, new technology, new medical approach. We evolve, so I don't want you to stop and get stagnant. Always learn. Number 3, accept criticism. Okay. Number 4, do not compare yourself to other instructors. We all have a several special way to communicate, to deliver our piece, to deliver our topic. Okay. So if you see one person, you idolize them, that's good. But you need to have your own identity. Okay. And number five, if you want to be a good instructor, you need to understand and listen to your students. Do not forget to ask them, not so frequent, like every 1 minute, 1 minute. My point here, don't forget to evaluate your craft, evaluate your teaching methodology. Ask them, did you understand? Okay. And if they tell you no, so be glad to do something about it. If you want to repeat the lecture, you can do that. An effective teacher is someone who was able to deliver the message accurately. Okay. So those are just my piece of advice if you want to become a clinical instructor. And of course, don't forget, wag kang manira ng ibang lecturer. And hello to my, oh my God, hello to my clinical instructor, Professor Sir Roy Labanan. He was my professor back in college days. And after that, naging colleague ko na siya sa review center. Hello, Sir Labanan. Nice seeing you here. What else? What do we have here? La Victoria, hi sir, looking forward to learn more from you here in the Philippines. Yeah, I am planning to go home. Most probably is coming December once we have our Christmas break, and then I will see you there, and I will have my NCLEX class most likely with Mom Amor and another review center. Hello to Pai Nikki, thanks for watching. Anyway, let's go back. We're talking about tips, okay? Tips for your NCLEX preparation. Tip number 4, do not put yourself in a box. It means to say that I don't want you to isolate yourself and put yourself in a standard, in a specific category. Okay? Now, give me an example, sir. For example, back then, or most likely, you were taught that the first action is always assessment, right? Huy, kaulaw. No! Sir Roy, no, don't be. Naulaw daw siya. I mean, he's kind of shy. No. I mean, where I am today and what I am today, it's all because of the hard work and dedication of my clinical instructors. And you're one of them. Okay? Anyway, let's go back. So don't put yourself in a box. Or one good example here, remember I said, most likely you were taught that the first nursing action is always assessment, right? So you always put yourself that if you encounter questions like that in the actual exam, you always choose an option that has something to do with assessment. It's incorrect. It's not always like that. Okay, it's not like that. Do not put yourself in a box that the first action is always assessment. That is why I said read the question. Okay, now there are times in your question or in the situation the assessment was already done or performed. It was already stated in the scenario, in the case that assessment was done, there was already a diagnosis made to your patient, and you'll be asked about what intervention is most appropriate. What is the best nursing action? See, it has something to do with what will you do after that. If you look at the nursing process, the basic concept, remember it's a process. Remember, if you can still recall the ADPI assessment, remember the diagnosis, the planning, the implementation and evaluation, you already had an assessment in the case scenario, so you don't have to do that. I said there is already a diagnosis to your patient. And what's being asked? What intervention? So the thing being asked in that specific concept, in the specific item, what action will you do? It means what intervention will you do? So in that specific question, in the given options, look for an option that has something to do with intervention, not assessment. See, that is why you have to understand the question. It's not always assessment. Okay, do not put yourself in a box. Another example, we were taught and we were instructed that if you if you plan to take any qualifying examination, it's a big no-no to pass the buck or pass the responsibility. It's not absolute. So do not put yourself in a box that you cannot pass responsibility. Let me give you an example. If you're planning to take NCLEX, there is an examination type called Select All That Apply. Actually, there are two types of Select All That Apply in your NCLEX or new generation, your NGN. The first type is your Select All That Apply. It means to say you have to choose the correct options. Okay? Now, it will not tell you how many options will be chosen. That's just Select All That Apply. Another type of Select All That Apply is the Select All That Apply N. N for the number. So here you will see choose four correct options. It means to say, among the given options, you have to choose four options, right? So in select all that apply, the first one, you will never know how many options will be chosen. In select all that apply N, it will tell you how many options will be chosen. Okay, did you get the point? I hope that makes sense. Now, one example there is, what are appropriate nursing actions? So you have to choose among the options about like appropriate nursing responsibilities or appropriate nursing actions. If you will see there, like deliver or give a complete nutritional counseling. Remember, we know back when I was still studying nursing, we have this nutrition concept. So we know what is protein is all about, what's carbohydrate, what's fats, what is the implication if you eat too much, too much fatty foods. The problem if you have increased purine intake. You know that concept. But if you happen to read a complete nutritional counseling, that is not part of your responsibility. Therefore, can you pass that responsibility? Yes. So you're not supposed to choose that because that is not your responsibility. That responsibility is for a nutritionist, dietitian responsibility. See? So do not put yourself in the box. Now, you're not supposed to pass responsibility. You have to perform that. Well, the answer is that depends on what responsibility is that. Is that responsibility within the scope of nursing, or is that responsibility belongs to okay, other discipline? So when I say other discipline, it could be other, healthcare team, like it could be a therapist, okay, it could be an OT, PT, doctor, med, okay, or speech pathologist or other disciplines. So that is why, as a nurse, you should know how to decipher which are these activities belong to the nursing, nursing concept or nursing realm or nursing scope of nursing. Okay, so is it okay to pass the buck, pass responsibility? Yes, if that is not part of your nursing responsibility. Okay, so that's tip number 4. And last tip, number 5. Okay, number 5 is answer at least 100 questions per day. Okay, now this is very important. I know some will tell you, "Oh, we don't have time for that, sir, because I am working. I work. I have double job, and then I have a kid, and then I have this." Please don't complain. I understand. We all have our struggles. Struggles. We all have our priorities. Go back and ask yourself, why did you take up nursing? If you keep on complaining, then you should not have taken nursing in the first place. Okay? So that is why if you start to lose your drive and passion and focus, try to reflect. I finished nursing now. The only way for me to practice my profession is to pass this examination. I should not complain. I am done, okay, going to school. This is the final step. So please do not lose your drive and focus. Try to reassess yourself. Ask yourself again, why did you take up nursing? So that you will be diverted back to your main path, main track, and that is to finish and pass the licensure examination. Okay? So answer at least 100 questions per day. Now, why is this important? I always stress this to all my students. Now, especially in the Philippines. Oh, professor, oh, sir, I already finished my review program in this review center. I am ready to take the examination. I always tell them, no, give yourself at least 3 to 4 weeks or at least a month or two before you will take the actual exam. And they will complain, oh, that's already a long wait. What will happen? I get stagnant and I will forget all the things that were taught during the review program. You know the common mistake? You know the common problem of student nurses? Is this. They know the concept, they know the theories, they memorize the concept. They know the signs and symptoms of every disease. They can define the disease. They can give the pathophysiology. But the problem is, they do not know how to apply the theories in the actual examination. And what is that? Critical thinking. Okay? How will you be able to develop and or hone your critical thinking? Practice questions. Okay? So please answer at least 100 questions per day. I can still remember when I took the NCLEX. Okay, oh my God, that is more, I think a decade, or more than a decade now. A month before I took the NCLEX, I answered 150 questions daily. I did not miss that. Every day, 150 questions. On top of that, I finished answering the book of La Charity. La Charity is the author of the book Prioritization and Delegation. So if you have the luxury and if you can purchase that book of La Charity is the name of the author of the book Prioritization and Delegation. That's a big help. Okay. So I finished answering the book of La Charity. I finished answering the book in 3 days. Okay. Then after that, I answered 150 questions daily. Now, why is it essential? If you answer questions daily, regular basis, 150 questions or 100, at least 100 questions daily, it primes your brain. It hones your brain to answer questions. It develops your critical thinking skill. Okay, so that you'll be surprised in the actual examination, it's an easy peasy questioning. Okay, it's an easy peasy qualifying exam. Oh, by the way, hello to Cham Tuazon. Hey Cham, kumusta? How are you? Are you back here in the US? Or are you still in Australia or in the Philippines? If you don't know, guys, Cham, I posted his picture like a few weeks ago. He visited me here in Las Vegas, and then he went to Australia for a short trip. And then I know, and then he needs to go to the Philippines before flying back. I don't know if you're back already, Cham. Safe skies. Okay, I'll see you soon. Anyway, so answer at least 100 questions per day. Okay, now some students will ask me, sir, what's your take about ATI? What's your take about, the green light? Now, you know what? We don't have ATI in the Philippines. Okay, just to be honest, we don't have ATI in the Philippines. If you do, I think you have to pay for it, and I know it's pricey, but where I graduated from, we don't have ATI. Our nursing curriculum is patterned almost the same here in the US, but how they implement the nursing curriculum is different. Okay. Now, my point here is you are very lucky that you have that specific review material, your ATI. Uh, Students will complain like, Professor, based on my friends, they said that the questions in ATI are difficult questions compared to the actual NCLEX. So I will no longer use ATI because I find it useless. That's a wrong mentality. Okay? Now, honestly, we have a sufficient data that will prove that students who complete the ATI and very religious with the ATI, they have 95% chance in passing the examination. Okay? And we have statistics data to back it up. Okay? Now, I know that most likely their complaint, the ATI questions are harder than an actual NCLEX. That's a good thing. Why? Again, it develops your critical thinking skill. Do not expect in NCLEX you be asked about what is the normal sodium level? What is the normal heart rate? Those are not questions in NCLEX. Okay? You will rarely encounter questions like that. The question in NCLEX will really steer your mind to use your critical thinking skill. They will really squeeze your mind, okay, to evaluate whether you know what you're doing or not. They will clearly evaluate whether you're a safe nurse or not. Okay? Anyway, hello to Eileen R. Brugena. Thanks for watching. And hi to Daryl Gernal. Hi, kumusta ka na? So, please, please, please never take the NCLEX examination without answering questions, at least 100 questions on a daily basis. So I recommend you do that at least 3 to 4 weeks or 1 month or 2 months of preparation. It's not that right after you finish the review program, you will take the NCLEX immediately. Okay? Oh, where's that? Hey, 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 hey. Wala. Where is it? I lost my monitor. There. There. I hope you learned something, guys. So those are my 5 personal tips, okay, to help you pass your NCLEX examination. So if you have any questions or concerns, feel free to drop a message, and hopefully, I will see you soon and will personally congratulate you for passing your examination. God bless, and I hope to see you soon, guys. Bye.